My name is David Meister, and I'm the CEO of Gaard Labs. It's a pleasure to be here, and I thank each of you for taking the time out of your busy evening. I'm going to make this presentation in English. However, if you prefer a separate call in Hebrew, I'm glad to do that. Just please feel free to ask. I was asked to keep this presentation short to about 15 minutes, and I understand that will be followed by a short Q&A. So I'm going to try to cover three things today. I'm going to try to stay focused on those three things. I'm going to start with the team background. I'll cover our industry, and I'll discuss Gaard and what we're doing and our strategy, of course. So I'm going to see if I can share a window here. Can you see this PDF file?
Yes.
Okay, great. It's legible. Okay, terrific. So let me actually take down this so I can see it as well. Okay, terrific. So let's get into this. I'm going to start with just team background. So I'm going to jump around a bit just to make this a little bit more succinct and friendly to fit within our time period. So shortly on myself, I'm originally from New York. Before moving to Israel, I spent 11 years working at Deloitte. That's me on the left over there. First as an auditor, then mergers and acquisitions, and then private equity. I'm a New York certified CPA. You call that Roa Cheshbon here. When I first moved to Israel, I did an MBA in Tel Aviv at Kellogg Wicanati, and I joined a global private equity firm. I was their Israeli partner. I got involved in cannabis about 4 years ago, first as an investment advisor, then as an investor, and most recently I co-founded Gaard Labs. My partner in New York, my co-founder in New York is Stephen Levy. He is a 30-year retailer, and he's responsible primarily for building out our direct-to-retail business and overseeing our New York fulfillment center. On the medical side, there we go. On the medical side, my co-founder is Dr. Howard Rubin. He's here on the right. He's our Chief Science Officer, and Dr. Rubin's responsible for our production, our product development, and our medical and scientific team matters. Dr. John Greenfield on the left is our medical director. He's an orthopedic surgeon. Dr. Greenfield has extensive experience lecturing in cannabis science, and he's a big part of our sales and marketing efforts. These doctors have a long history in pain management. Can you still see this? Okay, something just happened to me, but maybe you can see it.
Yes, we see the deep medical and science.
Okay, great. All right, so these doctors have a long history in pain management and stem cell expertise. Dr. Rubin served on one of the US Olympic teams, on their medical team, and he was also on the medical team of the LA Clippers. That's a basketball team. They own an outpatient surgery center, an MRI business in Los Angeles. So these are, senior guys in the medical world. Around 7 years ago, Dr. Greenfield and Dr. Rubin together entered into the state of Nevada. That was an early cannabis market. They entered the medical marijuana space. They were one of the first licensees. So since that time, they've become quite the experts in growing indoor marijuana, extracting marijuana, and in marijuana product development. We are supported by a group of advisors. And I won't go too much into detail on these advisors, but I will say that they are all aligned generally with equity incentives. We don't have our advisors here for their pretty faces. We know that can often be the case. Each one of these is very important to us. They each have a role, and they're all aligned towards our success, and they're all very busy with us. Some a little bit at one time, and others at another time. Everybody has a role. Okay, so what I'm going to do is discuss the background of the industry, which I have over here. Great. Okay, so the industry was legalized, or the hemp cannabinoid industry was legalized on a federal basis about 2.5 years ago. That's when Donald Trump signed the 2018 Agricultural Improvement Act, known as the Farm Bill. And you might already know the difference between hemp and marijuana. They're both cannabis, but one of them has 0.3% or less THC, and the other one has more than 0.3% THC. All right. So from a landscape and an opportunity perspective, when you think about this industry, this is a very fragmented industry. There is no single player in this industry that has more than just a single-digit percentage market share. What's more interesting is that this industry is growing very fast. 15% of Americans have already tried CBD products, and many of those are already frequent consumers. So it's become a large market very fast, and it's becoming even larger. In most states, the industry is underregulated. So there's a bit of a Wild West atmosphere. I'll go into our innovations, but suffice to say that in order to play in this market, you must excel in regulatory matters, and you must excel in sales and marketing. So let me go into gaard a little bit more, and I'll go through our timeline actually very quickly. So gaard was formed the same month that the Farm Bill was signed. We decided very quickly to focus our efforts in New York because we felt that the large market, approximately 20 million people in the state of New York, combined with an environment in New York, which is generally focused on very stringent regulation, would be a perfect combination of business opportunity and barriers to entry to protect us. And that's essentially what happened. It took us about 7 months to get our first license. That was a CBD research partnership license. So we were a CBD research partner to the state of New York. We then started to focus on the medical and scientific advisory board and our product development. And that was about altogether 1.5 years, almost 2 years. More recently, the licenses have evolved a little bit. We now have a license from the Department of Health. We have 2 licenses from the Department of Health. One is for retail and the other one is for distribution. These licenses, unlike most other places in the United States, require us to follow FDA protocols with respect to GMP production and labeling. So it's very strict. That's the background. Let me get into our products and what makes them so special. Because you've probably come across a number of cannabis companies and cannabinoid companies, but I'd like to describe, what makes our products so special. So we have 6 lines of products 6 products that we've come to market with. These products generally fall into one of our branding categories, which are focus, relief, calm, and soothe. The way we create products, which is different than I believe anybody that you'll find out there in the market. And if you find somebody like this that does what we do, please send me a note because I'd love to see it. We take 2 active ingredients. Our active ingredients are hemp cannabinoids, that's one family of active ingredients. And the family of active ingredients are terpene isolates. So you've probably heard of hemp cannabinoids, and you've probably heard how interesting they are and what they're good for and the different strains, so on and so forth. But you probably don't know as much about terpenes, and the market is just catching on to terpenes. If you look into this, what you'll find is that terpenes really are sort of the next generation in cannabis formulation. Now, what makes our business so special is that we've actually been working with terpenes for nearly the past 7 years. We're one of the first manufacturers on the, or our team rather, is one of the first manufacturers of marijuana products that are based on terpene isolates or blends of terpene isolates. So what are terpenes? So terpenes are, at their essence, they're organic compounds. They're found primarily in plants and throughout nature. Literally tens of thousands of these. They're largely responsible for the aromas in nature. If you smell marijuana, what you're smelling generally are the terpenes. And when you compare flower to flower in marijuana and you see that they smell a little bit different, that's generally because the terpenes are different from flower to flower. So what we've recently found out, and some have been on this for a while in terms of the scientific side of this. What we've recently found out is that these terpenes have tremendous therapeutic value, right? And the science around that therapeutic value is growing very, very quickly. I'll give you an example. Have you ever been in a forest, a pine forest, and taken a smell in that forest, a big whiff, inhalation, and you've said, wow, you feel pretty good, right? It's a bit awakening, maybe helps you focus a little bit more while you're walking down that forest. Well, that's not by coincidence. What you're inhaling are terpenes, and specifically what you're inhaling is a terpene called alpha-pinene, which is a common terpene, and it's one that we use in our ingredients. So the other thing about this is that terpenes are not easy to work with, and this is what makes it difficult, and this is the further side of the differentiation. Because we've been working with these terpenes for so long, we know how to work with them. Each one of these terpenes, or most of them, burn off at different temperatures and different pressures. Manufacturing with terpenes is very complicated. Most CBD manufacturers do not know how to work with these. It's simple as that. They just don't. So what we bring to the table is a 5-person medical and scientific team that understands the terpenes very well. They understand the latest in scientific and medical application of terpenes. And we bring a production team to the table that understands how to work and produce with these terpenes. You put that together and you have products that are next generation. Very, very differentiated products, very effective products. So maybe I'll peel the onion back just a little bit more. Each of our terpenes had, each of our products has anywhere from 5 to 20 terpene isolates. So we create these blends. Each one of these blends has a special purpose, either focus, relieve, calm, or soothe. And then we combine that with certain specific hemp extracts. And what do I mean by that? I mean that we choose the hemp extract based on its quality and based on its genetics. We won't take just any hemp extract. We're very picky. We know the farm where the hemp extract comes from. We know the extractor. We know this hemp inside out. We don't own the supply chain, but unlike most brands, we select and source these inputs directly. I'll repeat this because it's a major point. Most CBD manufacturers do not have this experience, and we've been doing this in marijuana for years. Okay, so that's our differentiation. Maybe I'll move to our go-to-market strategy. So let me move here to slide 10. Okay, where we're going. All right, we began with direct to retail, and we did this during a pandemic. We launched our products at the beginning of this year, about 4 months ago. Some might say, well, how come you didn't start with e-commerce? That would be the most intuitive thing to do. We decided to go direct to retail. The reason why we decided to go direct to retail was because we prioritized the legitimacy of working and collaborating with independent pharmacists, doctors, chiropractors, vitamin and supplement shops. That's where our legitimacy was going to be created. And that's exactly what happened. So since the beginning of the year, we're now in over 20 points of sales. We're expanding to other health and wellness points. We're expanding into yoga studios. We're expanding within the chiropractors. Those are big users of our products. They not only use them within their clinics, but they also sell them to their customers. We're expanding into golf and tennis courses now, golf centers and tennis courses. So expansion is happening quick. What's really interesting about this is that through the end of the first quarter, we've seen growth of 50 to 70% month over month. And the more interesting point is that we've done this with zero marketing dollars, basically nothing. All of our money thus far has gone into regulatory and it's gone into product development. So when you think about, if you add on marketing to this, and if you think about how quickly the vaccinations are occurring in New York, where things are coming back to life, and across the United States, we think we're going to be in a great place once we have a marketing budget. So we're excited about that. I said that we're currently generating 95% of our revenue from the direct to retail, 5% is e-commerce. We're now focused on building out our direct to consumer e-commerce channel. We're rebuilding our website. We're focused on branding, and we expect those direct to consumer activities by the end of the month with the funds that we hopefully raise here. Once we strengthen our balance sheet, we'll add additional channels, which we expect will result in very quick growth. Okay, so on that point, where's the money going? Okay, so from a budget perspective, we're expecting nearly half of our budget to go to sales and marketing, about a quarter of it to go to production and working capital, about 15% of it to go to licensing and regulatory, and this is largely around THC efforts in New York, as we expect to expand our brand into New York THC, and then a small piece into the general and administrative area as well. You've probably heard that THC was legalized in New York about a month ago. The applications will be issued, we expect, sometime in the summer, and we will be there. And we think that our experience that we have in Nevada in marijuana, plus our familiarity with the regulators, who are the same regulators that are regulating our CBD licenses, will give us an edge in that process. So let's talk about, maybe as an investor, you're probably thinking about exit strategy. How are you going to make money? So here I have a slide of some of the public market benchmarks. And what you can see from this is that companies in our space today, you can't predict the future, right? But what you can see is what companies are trading at today. What value is the market giving them for their revenue and their cash flow? And you could see that some of these comparables are trading at up to 40 times revenue. 40 times revenue, not EBITDA, but revenue. Some of them are lower, but they're pretty much all over the board. The averages, and that's the chart on the left here, according to the investment bankers, are anywhere from 5 to 11 times revenue. So this is pretty strong. And what we think will happen is that once the FDA begins to regulate this, which they're tracked to regulating this, and we think that'll happen within the next 2 years or so, that event, that FDA regulation, is going to allow a lot of new companies, big companies, to enter this space. So we're going to expect to see big pharma, big tobacco, who cannot enter now because of the FDA debacle, but they will enter this space within the next 2 years, more or less. And when they do, the pension funds, the private equity funds, they'll all be right behind them. So that's not going to depress the multiples. If anything, that's going to increase the multiples, or at least sustain them. I mean, we're happy with where they are today, but we think that demand, if anything, is going to give a lot of support to the multiples, or raise them. We're projecting run rate revenues of $50 to $100 million within the next couple of years. Do the math. Gaard Labs is one of the most compelling areas to put investors' dollars in currently. I hope you'll consider an investment in Gaard Labs. That's all I have for now, and I'm happy to take questions. So I'll go ahead and stop sharing my screen.
Thank you, David. If someone has any question, you can now write in the chat, or maybe open your microphone and speak with David personally. So it's really open for you the way you like it. If you prefer to close the cam and only write, I'm here to read your question to David, but if you want, you can speak right now. David, can you a little bit explain us more about the fundraising and the fundraising money, where we will go to?
Sure, absolutely. So I'll give you a quick history on the fundraising. The first money that went into the company was money that went in from the founders, specifically Stephen Levy and myself. The next set of monies that went into the company were money that came from friends. So, you know, the traditional path of friends and family. In this case, it was friends. All of that money, or almost all of that money, went largely to the initial development of the company from the regulatory perspective, the product development side, building our initial team. Now we're in a stage where we need to start focusing on marketing. That's really our big thing, sales and marketing. So according to our budget, approximately half of the funds that we're going to use will go into sales and marketing. Approximately a quarter of the funds that we're going to use are going to go into production and working capital, which means basically creating more products. So we are sitting on a nice inventory at this point, which we were able to put together from the money that's come in so far. That inventory is expected to last, perhaps another 2 months to maybe 3 months. But we need to start producing money. We have about an 8-week lead time on production, so we really need to get that in order very quickly. But yes, that's the primary money. We do expect to need to raise monies in the future as the company grows. We will have more sales and marketing needs, but the ratios and the categories will largely stay the same. Most of the money will go to sales and marketing. Some of the money will go to production, and the smallest piece will go to the G&A. We believe in running the company very tight through to exit.
Great, thank you. And have some questions. Someone asking where you see gaard 5 years or 10 years from now.
More where I see our shareholders and ourselves 5 or 10 years from now.
I think this is the meaning of the question.
I think that we're post-exit by that point. That's really our goal. Again, so our let me just kind of reframe kind of the exit timeline and why we think that the timeline is, call it 3 to 4 years. Most of the activities that we're working with today, let's put the THC aside, because today it's cannabinoids, and then the cannabinoids is a stepstone into THC. The large hurdle for companies to get, for large companies, for the big strategic companies, big pharma, big tobacco, or any large corporate to enter this industry, it's an FDA issue. Their insurers don't allow them to, their bankers don't allow them to, their processors don't allow them to. So you really need to build your business around this, which we've done. So we have banking, we have insurance, we have processing, but we've built it largely for this purpose. Once the FDA regulates, and again, we expect that to be 2 to 3 years. And by the way, they have a very transparent process. You can go online and you can look on the FDA website and you can see what they're doing and where they are. And you can read the articles online, and largely that's the industry opinion that within the next couple of years, there will be FDA regulations. So we will be seeking exit. The idea is to be well built out by that point, to have a sizable footprint across the United States, to own a very large territory footprint in New York. And based on that, we will be looking to exit.
Right. So you right now answered on it, but we have a question about the FDA and the other regulation things you need to do for your products in the future. If you can a little bit share more light on it.
Yeah, it's a great question. So the FDA is a little bit of a, in terms of what exactly they're going to do and how they're going to do it, it's a little bit of a wild card. We know that the big priority for the FDA is the medical and more so the scientific, the research part. The FDA wants to know that products are safe, right? I mean, that's largely their mandate, is consumer safety. So that means that the FDA wants to see more studies, and there are already in the groups of industry participants that are participating in studies together, and they're providing a lot of information to the FDA. And again, you could see this on the FDA website. I mean, there's a whole site dedicated to the resources that the industry is providing to the FDA. Currently, there are a couple of pathways with the FDA. There's a drug pathway, and there's everything else, right? The drug pathway is the only legitimate one currently, according to the FDA. Now, in order to go down the drug pathway, you have to do what a company called GW Pharma did, and they're the only company, by the way, that's done this with a phyto-based cannabinoid. In other words, plant-based cannabinoid, non-synthetic, They literally put in over $1 billion into clinical research, and they were the only company that decided to do this. Now, I think when you speak with people that are more on the scientific side, and you ask them about, well, why not go down an FDA pathway? I think what most people will end up telling you is the big benefit of the FDA pathway, of course, is exclusivity, right? That's the pot of gold at the end of the FDA pathway rainbow. The problem with exclusivity in this industry, and patents for that matter in this industry, is that it's very easy to circumvent them. The plants are the compounds, most of the FDA drugs, almost all of them, they're based on one compound, right? They're single compound drugs. When you think about the cannabis plant, there are many compounds. So circumventing a patent or formula or exclusivity is not going to be too difficult once you know what's in it. You can make a few changes to the minors. So that's one thing. The other thing is that we have products on a non-FDA pathway. We literally have products like this one right here. We have sprays that are so similar to the FDA approved the GW Pharma product, and maybe they're even better than the GW Pharma product, and they probably are because of the terpenes. So we don't think the FDA pathway makes sense, and from our perspective, the pathway should be, and I think this is the majority of the industry view, is a pathway more towards dietary supplements. They will likely restrict the amount of cannabinoids, of active ingredients inside each one of the products. They will make some sort of a limit, and they will probably say beyond that is a drug and below that is a dietary supplement. That's where we think the FDA is going to go. They are so under-resourced that it's not going to take them weeks or months to get there. It's going to take them at least a year or 2 years. That's fine for us because that's actually where our opportunity is. By the FDA precluding larger companies from coming into this space, that gives us our opportunity to compete. Soon enough, the FDA will regulate this, the larger companies will come in, and then they will have a choice. They can either buy their way in or they can start from scratch. And we know how large companies work. They typically buy their way in. So that's where we hope to be.
Great, thank you, David. So we're running out of time in our meeting. So if everybody have any last question, we have something like 5 minutes on the clock. So any more question from the audience? So you can write for me in the chat. And there is last question for us today. The question is about your competitors. If you can a little bit explain about them. Where are they standing and where are you?
Yeah, excellent. So let me do this because if we have just like 3 minutes, I want to do this in a nice structured way. I'm going to go back to this PowerPoint and I'm going to share one slide over here. This is a slide that our salespeople have this down packed at this point, right? But when we go into, can you see this well differentiated slide over here?
Yes, sure.
Okay, so when we go into a store and times are slow, it's pandemic, and they have 5, 6, 7, 8 brands, CBD brands on the shelves, you can imagine the first reaction towards us. They're laughing at us. What are we going to do with another CBD brand in the middle of a pandemic when hardly anybody's coming into our store? Our salespeople have this down packed. They understand this very well. And we understand today, we literally have in almost every place that we go into, when we walk into the store, we have a spreadsheet that compares our product to every single product that we expect to see on the shelves, right? It's an extensive spreadsheet. We have a bunch of brands on there. We have the pros and cons of all those brands versus the pros and cons of ours and our thoughts. And our salespeople know this spreadsheet well, and they know how to do this very quickly. The synthesis of that spreadsheet, putting aside those individual brands from a 30,000 foot perspective, it is said that there are around 3,000 cannabis brands in the United States. Now, most of those brands, probably upwards of 90% of those brands are white label, which means that you go to a manufacturer and you say, I want A, B, C, or D off of your menu, and you just market it. That's not us. Our brands are built from our products are built from the ground up. They're very unique. They're different. The terpene element is very, very different. And we have additional innovation in our product development pipeline. I mentioned earlier the GMP elements, the licensing. We are in the most highly regulated licensing environment in the United States. Most manufacturers across the United States, CBD manufacturers, are not GMP because they just don't have to be. And it's very expensive to have this sort of regulation. So, you know, you've cut out in this, you know, more or less, you've cut out most of the market. Now, you factor in our medical and science team that has been doing this for the last 7 years. Some of them up to the last 7 years, some of them a little bit more, some of them a little bit less. They've been doing this for a long time. They understand this business inside and out. They understand cannabinoids and they understand the endocannabinoid system. And they know what happens when you take phytocannabinoids, plant-based cannabinoids, and you put them in the system and they lecture. And this lecturing, when we have our sales, when you think about the sales funnel, we take our doctors and we put them on top of the sales funnel. So after a few minutes of the salesperson in the store, we invite the retailers, the pharmacists, whoever it is, we invite them onto webinars with our doctors and we approach it from the scientific perspective. They love this. So that's very differentiated. Then again, you think about the terpenes. Then you think again about the advantages that we have in New York, which is largely a market that's been reset with new regulation over the last few months, and puts up barriers of entry. We're in a very strong position from a differentiation perspective.
Thank you. It sounds really, really good. And thank you everybody for being here. I'm putting in the chat the campaign in PeopleBiz. אני מזמינה את כולם להיכנס, לראות, לקרוא, you can enter and read and see more about gaard. הצוות של PeopleBiz פנוי עבורכם, אתם יכולים להתקשר, לשאול כל דבר שאתם רוצים, להשאיר הודעה לדיוויד, כדי ליצור איתו קשר לגבי המשך. ההשקעה היא לזמן מוגבל במינימום של 100,000 שקלים. Thank you, David. It was a pleasure to be here with you. And thank you, everybody. Bye-bye. Good evening.
Thank you.